Actually, last year FGM started a bit earlier than usual because normally it starts by December. It's not to be the cutting season. But last year, because of the COVID situation, because now pupils, schools had been closed and people were at home, then it started a bit earlier. Actually, it started by October. So the situation here was worse than the other years. I also want to say that from that period, now schools opened by January. I want to say that now the situation on the ground, most of the girls are pregnant, others have given birth, boys have got married. In fact, I want to say that there is a very high level of school dropout. And this one has really been contributed mostly by COVID and the FGM.
And so our main work is to promote and sustain FGM dialogues with community members. And we have a policy, we leave no one behind. So in our programs, we try and include everyone at community level. So one of the ways that we engage the community is through radio outreaches. And this is to increase access to FGM information and knowledge, as well as sharing and spreading information on FGM. We have also our main activity, which we passionately love, which is the Girls Empowerment Mentorship Program. So we do this every year, especially during the cutting season, one with the aim of providing an escape plan for girls that don't want to go through FGM, and also for parents that don't want to subject their daughters to the cut, because there's a lot of pressure during this time for parents to subject. Sometimes if the parents don't want to cut their daughters, it's the families, the extended family members that want the girl to be cut. So the Girls Empowerment Program, one, seeks to provide a safe environment where girls can stay during this cutting season. And also, while they're staying there, we take this opportunity to do training workshops with them on gender-based violence, all forms of gender-based violence, sexual reproductive health and rights. We talk to them about human rights, the importance of education, life skills. We also help nurture their talents. And we also talk about culture and religion. And also this program actually provides an alternative rite of passage for girls instead of the girls going through the cut. So it's one way of transitioning the girls from to adulthood without really necessarily having to go through the harmful cultural practices, which is FGM. So as Zinduka, we've taken up this initiative to provide, especially the reusable sanitary towels, which stay longer, so that every month when the girl starts her monthly period, she is safe and has sanitary towels available for her. It has been said that men are the biggest consumers of FGM. So as a looker, we feel it is very important and crucial to engage men and boys from a very early age, so that they grow up with an informed mindset and they don't have to make decisions based on their ancestral beliefs. And we also have exchange programs, and we do this with other FGM practicing communities. That is to learn and share best practices. Another program we do is that we support vulnerable girls in the community with sponsorship, with school sponsorships, to just enable them get quality education and enable them to, to have a chance of becoming better citizens through education. Our overall future plan is definitely to have a Zinduka empowerment, guidance, and counseling resource center for all gender-based victims and FGM survivors.
I also want to say that we are very much grateful for the partners and well-wishers. Actually, it's through their support that we as Zinduka, we are here, we are.